Hi there. I'm really happy I get to talk to everybody today. I'm excited about what Jeff said because I think it plays well off what we've been doing here in Simcoe County. Our initiative was a little bit different. We started as a Stigma committee about 3 years ago, looking at how we could address the barriers that you felt in accessing services. What you're seeing now, I think we're starting to go through some of my slides already, but we wanted to get honest feedback from youth about what their experiences have been in talking to adults or service providers or anyone in their life about mental health issues. We were finding that a lot of what we were getting was surface, you know, this is good, that's good, but nothing with any real content. We wanted to give youth a real voice in changing the system, changing the way that we worked with them to help make it better, help make it more accessible, because we recognized that if we couldn't get youth in and talking, then it didn't matter what we were doing because we weren't getting the right youth through the front door. So it was essentially started not as an exercise in finding our successes, but in finding our failures and talking to those youth that we hadn't been successful in engaging. So what we did was a series of focus groups, and we used art as a means to engage those youth. So we used a mask exercise. So you can start flipping through some of the slides slowly, if you like. What we essentially asked youth to do was to create a mask that represented what they felt but they couldn't express. So some of these are pretty powerful images, and then we took their thoughts about how they would describe that slide and what they needed the adults in their life to know and transpose them into a presentation. So you can move on to the next one. I think that's pretty telling. Next. So the youth we surveyed, or the youth that we worked with in the focus groups, were, like I said, the youth that traditionally we hadn't been able to engage in our programming. The youth who didn't want services, the youth who had had experiences with services, and said they never wanted to see counselors again, or they wouldn't talk to an adult in their life again. You can go to the next one. This was a chance for them to give their opinions on why they didn't want to be involved anymore. Next one. The next. These are all just examples. We've now done this math group probably with 6 different groups of youth and come up with a lot of additional feedback. So what we did, you can go to the next, and the next one. I think that one represents a message we heard over and over again. Now what we did after we did the masking exercises, we asked a series of questions, essentially about what it was like for youth to ask for help. So these are some of the responses we got from them. We were looking for ways that we could change the way we worked and not necessarily change what youth were doing, but we recognized that there were things we were doing as staff or workers or parents or adults in youth lives that weren't working for them and that were creating stigma, that we were part of the problem and that we needed to make change. Next. So I'm sure anyone who works in the field or has interactions with youth can probably relate to some of these messages, and I think a lot of the times we're stuck with the idea of what we're going to do with that and how we can make change and make the system better. Next one. So that was what we asked youth next. What do you want? What do you need from us to be able to make asking for help safer? This is what they said. 3 basic things. Listen to me, believe me, and the last one was try and understand me. What we asked them after that was what happens if they don't feel like they've gotten those things. And again, very telling. So at the crux of everything was essentially how we could make things safer. The words safety and trust came up over and over again in our discussions with youth, that they needed to feel safe, that they needed to trust the person, they needed to relate to the person that they were talking to be able to ask for any type of support. So these are some of the suggestions they had. That message there was key. Don't forget what it's like to be a youth. So at the end of this, we were left with sort of all this great feedback that we had from youth about making the system better, about their experiences, about what we could do to make change, and we needed to do something with it. So again, we went back to the youth and asked them what they would do. And one of the most poignant suggestions that they came up with that we started to implement was the idea of the reverse questionnaire. So essentially what this is was youth saying, I'm coming in and asking for help, and you're asking me all these questions. You're expecting me to disclose my deepest, darkest secrets. You want me to talk about my issues, but I know absolutely nothing about you. And that's not fair. So I need to know about you. I need you to challenge your own boundaries around self-disclosure and tell me that you can relate to me on some level. So they came up with this series of questions in the reverse questionnaire that they thought was important to know about the people that they were asking for help from. So have you ever experienced substance use, mental health issues, abuse, suicide attempts, legal issues, anger management issues? All of these things will ring true for anyone who's ever worked in an organization, probably where you do intake and assessment. Essentially what the youth were asking for was a chance to talk to us like it was an intake, to be able to relate to us. So when we started presenting this idea to staff and saying this is what the youth we're working with are asking for, you can go to the next slide. Everyone's guard started to go up a little bit. So we needed staff to be able to feel safe to and reflect on how they felt about self-disclosure. So we started doing some training, which involved showing the slideshow, talking about the idea of the reverse questionnaire, and then exploring staff perspectives on self-disclosure, boundaries, and how they felt about using the reverse questionnaire in practice. These were some of the questions we would ask when we were doing the training with staff, how staff felt about that, what would help them feel safer. We actually, at one point, started doing the masking exercise with staff and having them create masks of the things that they keep hidden in their professional lives, to start to remove those barriers and talk about why they were doing that and if they felt it was appropriate or inappropriate to self-disclose those things. So from all of this work, we were able to basically create a toolkit that helped our organization to challenge what we were doing with youth. So that involved three things. It involved the PowerPoint and the reverse questionnaire. It also involved a full art curriculum that we created for youth that challenged ideas around stigma, mental health, addictions, all of the things that they were experiencing. And then a series of suggestions for policy changes. So exploring our intake and assessment policies. Did those need to be as intrusive as they were? How were we measuring successes? What were the alternatives? How could we be flexible in working with youth to make sure that we were meeting their needs? How could we create safe environments for staff so that they felt comfortable self-disclosing to clients, so that they felt comfortable using the reverse questionnaire, sharing their own experiences? We really explored a lot the notion of peer support and why we felt that peer support was necessary when we recognized that a lot of us as staff had had our own personal experiences with substance use and mental health, and how we were using our peer support within the agency. Were we using that person as sort of a token, or were we using them more appropriately? We continue to do the focus groups with youth. We continue to try and seek out information and make change. So what started as basically just a small little project that we thought we'd get some basic feedback about how we were doing things has really turned into 3 years of exploring our programming, ourselves, the way we practice, the changes we need to make to reduce stigma for youth, the changes that we can do interagency in terms of policy, and not just looking at reducing stigma from the perspective of information sharing and going in and doing presentations and all the things we were doing, but also looking at our own practices and seeing what stigma they were creating.
Okay, thank you, Stephanie. That was a great presentation and really powerful.